boy amaya chichesa enkomo we see or no ye Dr. Kweku Ade ahe appear or a senior lecturer School of Medicine and Dentistry Kwame Nkrumah University of Science and Technology and also head of urology unit Department of Surgery Kofor not teaching hospital. Dog, welcome. Bibia Bokodi. Before me no be share no make September year 2 awareness seminar ye creative means be can all the be minimum you know say childhood cancer awareness month and a prostate cancer awareness month. And so yes one year creative but this year no mo team no say close the care gap. Okay. So you're aware about the team. Okay. Yeah. Now, I must say, this is about understanding the inequities in cancer care, taking action, and to make the necessary progress to address them. The symbol I'm use so a light blue.
Okay.
So why this team for this year?
I should say, Netini say yare no nipa bebre ate ho asem but omuni mu ho nimde pi.
Okay.
Enti empen no Beba hospital so mo basic help no na are too late. If you can close that gap between what we doctors we see and what the patients are also knowing or get to know, then it will really help.
Okay,
and
so,
fast team.
Okay, so closing the gap, no, the care gap, no, is centered on the care that or the awareness that we are creating or the care that the doctors needs to give.
That's right.
Okay. Okay. Your topic now, you're fine. I see you and your prostate. Why you should care?
Okay.
What is prostate? And I say, "Cause prostate idea
prostate ni nipa duana kwa no bako. Ni position baby a shepherd there. She wahu baby a your boy a belter, mema your boy a belter edano. So I don't pay on your friend pubic bone.
Okay.
Edanechi.
Okay.
Ana sebi baby a tukwan no no. And also edaso.
Okay.
Eda tukwan so sa. Ana nia ade won sro eye dwunso twa no.
Okay.
Nti dwunso twa na ano no any prostate no efuse. Ana prostate na no ni ti ekohye baby a your friend no external urinary sphincter eno the control dwunso se be ya nipa dwunso de na se onyanya ready so be dwunso a onyunso dwunso ho ene friend no sphincter no. Nti prostate no obusa me a na ye nipa akwa bia ye wo nipa e wo ni body num sa na ye kete se nipa no o tamp ana se okokromoti unyini na no so enyini dwumadi a edi ma nipa dua na pa ne se e produce aduane a sebi o ba ne be ma hia be ma ne oba hia ne hunsuo na e ba no sperm na obi anu e friend akoboa na se den akoboa sperms no enkwamwa okay me da say no na ehia aduane if say sperms no besumi akohia oba no kosua na ehia sa aduane prostate no edema any produces aduane a eboa ma akwamwa yi etimi esumi kosua no ho.
Okay. Yeah. Okay, it's only prostate no.
Yeah.
Na ye kase kokram na se cancer e no so ye kire mu say.
Say kokram ne ye a friend is say nipadua no say da bia e bi emu chiche mienu ye friend nipadua na ye friend be cells. Okay. And then they come together form tissues. Now tissues now come together to form an organ to say akoma. And I say to say brabo and I say to say prostate. Ana organs yi nyina akeka bom ana beda ni nipa dua no na emom cells no nyame hyehyɛ ne sɛ tambia no eba ebi ebewu na foforo eba ebi bewu na foforo ba etomre bia cells no escape sa normal cycle growth cycle enti omungu instead some bewu na ebi nwu na ma tissues no they grow out of order. And your friend kokram na enye say grow out of order ma tissues near kese keke kokram no che say it me spread it is a chassis or prostate numa sa abnormal growth in chassis or prostate numa obehu say wan hweni abehu anadru wakoma na wahremu ana wadwene mu ana omrebo mu ana se madwa bebre wo nipa kwa numa etimi didi kom eno nti na friend no prostate cancer etimi spread it can spread yeah.
What can you now prostate cancer? How common is it? And also, Bebusa say, you tell who hospital.
Prostate cancer is very common. I mean, statistics say we member nsia emubako ebenya prostate cancer and san obi wo. Okay. So 1 out of every 6 men. In fact, enumpo ye for Caucasian statistics. Okay. Into share young blacks in India, it's almost like 1 in 4. Inti ansa na obema bia be ko nimfi na tipia obewu afri wiase no 1 out of 4 men will develop.
Cleveland clinic so that they won't block our Facebook.
That's right.
I think that's every so can my own their church about prostate so that to be share we hono be them say a year free so anyway but you say betin send your picture na Intimifa, I was so.
Yes, prostate now.
Yeah.
Adefita na a friend of pubic bone, a pubic bone, and now who say a war a new pan. And now share a dear nice bluish, pinkish blue. And no, I actually had arrow nature say prostate.
Yeah.
Now share a so channel, I say.
Okay.
And I took Rona da Bema. I drink so from who out to me say. And now prostate nimfinfia
and it's yellow
and then it's yellow no and a bio so no who baby I call sebi ye jay 9 fana I friend rectum na prostate ni da so enti mpempi no don sa hye obema to a on sa kan prostate no on sa kan
okay okay
enti picture
and it's more one of more labs say rectal bibi
friend digital rectal examination yes
oh okay okay it's the eye say a purple, light purple, or light in a shade, Johnson channels, and no near prostate,
and your friend of prostate.
Also, all the mess, no.
Yes.
Wow.
Yes.
Okay.
Yeah.
Okay. Doggy uncle so. Prostate cancer. And I say, "Kwame to a member, make us a Johnson channel." Can I say, "Nchino"?
Bladder.
Johnson prostate no. Prostate no.
Prostate in the yenya ni trio. Ubeti prostate.
Is it genetic? Can I say hereditary? Something like because so be papa will be, and I say obi buseni bi will be into no so be bi.
Less than 10%. Okay. And genetic.
Okay.
More than 90% is sporadic.
Okay.
Sporadic nature say. It means to see baby when in now so. Okay. Nemo ye enema e de ba no bi e te say obi ewa busiam. Ko busiam no bi o ho a grandfather no enya bi.
Okay.
Father ni nya bi. Ne man nso enya bi. Anti but fortunately no na make say a new 10% of the causes of prostate cancer. Yeah. But
it's possible so we be a bit through that.
Yes, especially say oh papa enya prostate cancer bra onya 65 years e ma o chance of say obenya prostate cancer no e cost
high.
Yeah. Okay. But so papa enya 80 90 no onya prostate cancer pempi no or risk any obia ni papa enya bi ni almost the same.
Okay, mami busa we answer yato. Does age really matter when it comes to prostate cancer?
Very very much so.
Okay.
Prostate cancer enim say entancy abra nipa ni nyanya 40 years. And if you 40 years e kono ana emema timi develop prostate cancer but the peak age is 60 years and above.
Okay.
It is so far mema omanya be 70 years e kona more than 50% enya prostate cancer. Okay. But in PMP no enya clinical prostate cancer. That means nipa no beti abehye nipa no ho ama wawu but wo hu mpo no prostate cancer. That's a good thing about prostate cancer.
Okay.
It is our statistics here making na postmortem say nkofu from different causes like heart failure or any accident no wawu. Na abehwehwe mu no be hu say omomanya 80 years no more than 70% prostate cancer so nyanu ne ko and about omomanya be 50 to 60 now about half or less than half was our prostate cancer.
Okay. So you better take a crack for your questions. So me busa say age matter. But a DNA bema will be enya prostate. What is the early stages no? which comes into the signs and symptoms, but we'll talk about that. Na obenya animanimu ya na say obenhu the symptoms so say ibia or John so and you beka was a moje bania de na be man nipa nya sa quick reaction no.
Okay, so the omni say early prostate cancer any symptoms be.
Oh, okay.
Early prostate cancer any symptoms be.
Okay.
In fact, your early prostate cancer which can be asymptomatic or symptomatic.
Okay.
So asymptomatic nature say a morning kai be on nam ho just say obi a what say you can prostate once no akoye PSA test.
Yeah.
And so yeah, akoye PSA test so PSA no cosro.
Yeah.
Na yakoye test be so when your prostate cancer. And near asymptomatic and no dose.
Okay.
Anna near toso ye symptomatic by early stage.
Okay.
Inti symptomatic no e ma can kaya bebo wa ye bia odwin so musisa. Inti bia anajo first now be crab down so. So be hu ana fe de be 3-4 times a night. And I said during the day who so odwin so tentem and I say bia one can ho pe na ya adwin so ho ana bi okra na adwin so no odwin so agise ochuma ansa na ba na say ye beto rubber because odwin so ntimi ma. These ones and pain you know e be do that stage na ya re ni yedu nanim.
It's yaka when they emphasize symptoms no.
Yeah.
Yen ken ho asa.
Enti sad symptoms ya mabobo a friend lower urinary tract symptoms.
Yeah.
Yeah, me can frequency, urgency, nocturia, and obstructive symptoms say straining, hesitancy near that thing no. And no
Pain in kaho.
pain and kahon.
Okay.
And pain no early symptoms in.
Okay.
Na ya nhwene ya nka ho asema na fe a spread to local organs no obi di say on say me ka say rectum ne da so ana me ka say bone pubic bone so da ni mu enti are ni timi di rectum no obi say nipa na fe de onya constipation ana bi kra be ko tie fi ne moja wo ana say are ni timi di ko odwin so twa no because say hyase pe enti are no cancer ni di ko ma bi o ha badwin so ne moja wo aha na ebi on so cry nipa ne oba ne be hia na hu se moja wo a che say are na didi course seminar vesicles. These are the locally advanced symptoms.
Okay.
Ana ye wo symptoms bi a are ni didi ko akiri pa e de ba eni titru ne bi e bone pain especially say wo sisi bema bi o ha in fact mema pi no mo anyinye mo fie bro 60 years oba na complaining severe waist pain me priority ne say me rule out prostate cancer.
Okay.
A bit me didi konom penum ema otiminya what you call pathological fracture. To say bia me no say ye tissues ya ye be sorry I bia enemu mu. And so cancer ne timi didi obi no mpemu na amana ye peche and so enti no ade small force or TikTok akra bia be on say namabu and your friend pathological fracture. E bio yare ni timi didi ekonompe no say nompe ni mfimfin echimu no eno na produce red blood cells so enti say e ba say yare ni essa echimu na afi hu moja nyina timi hwe aha obi o wa etabo ni moja in fact so obi o ho na bi odwun so moja nim okoti afi moja nim na so tambia na moja awia say one of the things that doctors nyina ni baso ne say ade prostate cancer na say o hwehwe mu PSA test yare no mehu bebre a edidi ko akire obi be ba na bibi bo no ma so say torchlight o say o doctor me bi pro na me tri e bo me say all mind that be.
So what can we say na what can be mistaken for prostate cancer?
Yes, antina na many abra me bobo symptoms na refer no story symptom na voiding symptom frequency urgency those things and pain you know you obi abekan say say onya prostate but na ye benign prostatic hyperplasia BPH so prostate na ye kese but enya kokram pain sa symptoms ya me bobo so ya na adwo sorry bebre wan kan ho na ya adwen so ho nya dan and also the sa symptoms near dan eba na anampo se obi o na ne be mam tokro no wanya sebi your friend no gonorrhea you can choose simple baba so ya na wa hwe entity ni ye obi won say going forward na after be 15 years obi won say ni tok be man sebio be man tokro no dem no kutwa bem and on sinti wo dwun sa bechem sa bedwun so tentem those things. These are all problems see lower urinary tract no kwan. It's anything that can cause the flow of urine to be blocked can be mistaken for prostate cancer. A bladder neck cancer, bladder stones, BPH, a friend benign prostatic hyperplasia. No, so common AMPOFO a bibidrofone or Wontumi treaty.
Okay.
AMPOFO na problem ayenya ne say. Nipa na AGYEI drone de onim say o treat ne ho ne bio ne prostate o treat ne absorb enam say cancer ntino. Adronia ntime no obehun say obeba no na dru stage either so bubu ago anan hu moja nyina re yeta hu sa de ne pa eno nti na ye sa ye ni abra ye bossa dawri.
Okay. Okay, so when should one start testing for prostate cancer and how often?
It depends. Say in fact ideally 45 years. Bema, sayare, mema yare.
Okay.
Ideally, for the general population, we are looking at 45 years and above. From 45 years, biano, and kabinya every year, bia, no akoye sa annual screening.
Okay, so from my research into this, because I remember yare, you know, once I learned say for people who have normal risk, like who their race winning a high, no, they can start the screening at 60.
No, 60 is too far.
Okay.
60 is too far.
Okay.
And every there's no, and I'm saying blacks, your risk is already high.
Okay.
And for blacks, we are looking at 45 and above.
Okay.
Now, so obusunyo mu papa nyebi, especially no nyanya 65, ano nyebia. It's advisable say from 40 years every year bia obey start testing a friend PSA. Now they are urologists, not so the cultural bia.
Okay. Okay, so I can say one mention about who are the at most risk of developing prostate cancer.
I know me who jam ma me can read there.
And patroni eka.
Blacks.
Okay.
Yeah, blacks yeah risk near more than 2 times abrofo white people. In fact, yes, I have more than Chinese Japanese it's almost like before a year.
Oh, okay.
Anna near tosumi aging after 40 years you can get it. Anna near tosumi and say family history say obusia mobienya bi. These are what you call these are absolute risk factors, but they are kind relative risk factors, which is smoking, sedentary lifestyle, or exercise, or eat too much fat, or eat too much red meat, or no too much alcohol. Everything in moderation. Also, it may risk a cost kakra. Now, per se, or prevent it, and I knew me bebuama a risk in a form, a BSA. We do a lot of fruits and vegetables, replacing most of your red meat with fish, cutting down on your consumption of smoke and alcohol, and exercise.
One can do, and as a man can do to reduce their risk.
To reduce the risk.
Okay.
Yeah.
Okay. So when it comes to screening, now what does screening for prostate cancer involves? Okay,
so near I say afibia bema wenya. It's 45 and I say 40 when no papa na unya bienya bino afibia be PSA test.
Okay.
Na doctor and so I digital rectal examination amount.
Okay.
So these are the 2 main things we do just to screen for prostate cancer. PSA every annual PSA screening.
Before I become
digital rectal examination.
We say, do men really come for this screening, and are they aware of this?
Yes, fortunately now, I mean, when I started as a urologist, most times prostate cancer never banana very advanced. Is
the screening for the rich?
No, screening is not for the rich.
Didn't tell me Busa is about the cost involved.
Yes, that one you got me there. But it cannot be just for the rest. Fortunately, I buy say or better prostate cancer going forward.
Okay.
Maybe from next year going.
Okay.
As
a preventive measure, and I say as treatment.
So nipa ni nyanko dia
Okay, so it's not preventive, it's treatment. So how do we say I can't just phantom it? Why is it that the insurance doesn't focus on preventive side, and then I just say?
But can you really prevent prostate cancer?
No, so you can't prevent. About the screening, it says screening is secondary prevention. So make up prevention, that's what I mean. So when
early detection,
yes.
For early detection, yes. Until from next year going, hopefully they'll be adding it to the insurance. But really, you ask a very sensitive question. Is it for the rich? Actually, it's for every man. It's not just for the rich. Only that, I mean, some of the PS in your bahne or srone cassia, prostate biopsy, just so that we know, say cancer and cancer. No, baby, be 1,000 cedis, and I just owe you bottom, and 1,005, baby crab bro.
That's for the biopsy.
That's for the biopsy. Into a biopsy now, a cancer woman. I see who say I already did quite and I am quite.
Yeah.
Jebe mo akoye CT scan and afi ka ne ba you that question na obusa ne ho na opese push ko but I hope that with time any next year kono aban kaso be fa ne ma we nyina.
But with the prostate specific antigen it doesn't cost much.
Oh no and they could have 100 cedis cry or sometime below
but insurance no cover us at this time.
For now no.
Okay. So when a patient is diagnosed of prostate cancer, why ne was no?
MPP no urologist any diagnose prostate cancer. If you say
so it's not the oncologist or you diagnose and then the oncologist treats.
We diagnose we diagnosis say when you cancer now you screen you stage anyway that is your mouth you say spread there. Yeah, it's a shared area between the oncologist and the urologist.
Okay.
Because you are not treatment, open surgery, a urologist now said yes, obey operation amount, and now radiation, a oncologist. It is sometimes you know better I say near discussing all the options. To know better find a better direction of the
Okay. My share, what are the risks and benefits of the prostate specific antigen?
Yeah, a good question. Screening, doing PSA no. In fact, me catch you say a man might be 80 years. Oh, yeah, post-mortem on or from different causes. To say heart attack, diabetes, hypertension, carbono, no. Yeah, post-mortem, you say more than 70% of men above 80 years have prostate cancer.
Wow.
But any yare in your comb. Any prostate in your comb. Yare from your comb. A sure say, yare no, any tembiana in yawa, a become. But your coy PS in Nuna, you so dear. Senior eternal, SLBia will go through all the steps. Say by be treat you.
Okay.
And only one disadvantage of this screening.
Okay.
Prostate cancer near what you call indolent and lethal forms.
Okay.
So there are very much high levels of indolent prostate cancer. We bet me in his 60s. Our bill bear 70s, 80s, and yet prostate in the bekuno.
Okay.
And you got the lethal, very aggressive ones. We bet me in the 50s, oh no 60 no kuno.
I think I asked that question. Say, the number will be like few days and that's a few years.
Few months.
Few years or months.
Yes.
Yes.
Because I don't know the behavior is different people.
Oh, okay.
Your low risk disease, high risk disease, intermediate risk, and a high risk disease.
Okay.
It's depending on what the person have or has. Ebema yare no either say be obetimi a transfer 10 years na nye no hwe and be 5 years crime to no Nti the first kwasi papa nya prostate cancer odi nya 80 years and above ahwe anya ne nche se kwasi papa nya bia.
Yeah. Okay, you say near fantasy after detection, what's the chance of growth?
After detection, what is the chance of growth? Do you mean say after say you detect you treat you no?
No, after you detect say when you have prostate cancer, BTQ say na I give a break cancer na do so and say the consistent.
I think the one I may try to emphasize.
Okay.
Me show there are a lot of considerations we put in terms of treating patients with prostate cancer.
Okay.
You show fear when you be on your best 70 years. You show yare awo be a situation or hypertension or heart failure any other day.
Okay.
It's near calculate your life expectancy. You who say okay, papa we putting everything together and you're likely so be more than 10 years.
Okay.
The yare no ye the indolent type. Yare no unholding any a ding or form. Tisano yen no. Yen aggressive treatment. Yes. Obi on so oh yeah, be 50 years. In fact, me treat a lot of people in their 40s or mania prostate cancer.
Yeah.
Now share yare ni a ding said near now share so when you be 45, 46. Oh, won't feel be brio on any.
Yeah.
Inti basana, so you won't be.
Yeah.
Why you won't be within 10 years? You are ready to make a partner.
But treatment is one some more normal and my suicidal thoughts. Because after treatment, there is so much confusion and dysfunction of some systems.
There's a chance for recovery.
Really?
There was always a chance for recovery. It takes time.
Okay.
I
mean,
no problem.
Okay. Okay. I think what are the risk levels? So can I say me I forgot the risk levels no.
Yes. So you asked about Gleason score.
Yeah.
You asked about what is Gleason score. Yes. No. Say waba doctor I few or didn't I share or two coin who say as a prostate now is suspicious. How do we know it's suspicious? Normal prostate ni senia ni feel it no. We don't say me it is say ohene tip no. Firm. Nemu me yakukrama ye de nsa kan I say a body I say wood.
Ding.
Na edin. Iti ye de nsa kan ye hu.
Okay.
But enye sensitive enough.
Okay.
Iti be mo akoye PSA test.
Okay.
Ti PSA ni normal ni 0 to 4.
Okay.
Nti uba na abro so a. Anase bia we 45 years, but PSA 4. And also abro so.
Okay.
Ko at 45 and it's abro 2.1.
Okay.
Nti ye hwe sa nyoma ni nyina, ni aye biopsy. Now, biopsy no pathologist na beka cho so ni Gleason score. Eye bia 7. And I 8 and I 9 and 10. Okay. Between 6 to 10 naturally.
Okay.
Now 6 a mild disease. Just say I no mpempi wa anya ho hwe 10 years kra na nipa ne ho.
Okay.
And your intermediate disease. A 7 Gleason score 7. No it may be a honey ho.
Okay.
And you the aggressive type between 8 and 10. These are Gleason score 8 to 10. Now Gleason score the pathologists look at the cells and compare it to the normal cell, how the normal looks. If it looks quite close to the normal cell, 6. Yeah. If it has no resemblance at all, nothing shows prostate cells in it. 10.
So your pictures about prostates, no meaning say to me add the pictures now so that you can na actually phone so share. Okay.
Into any day, senior prostate na kese. Asema me can under the microscope.
Okay.
Say ye be akoma pathology no under the microscope. Now compared to normal cells. It's when it's like 10, it's anaplastic.
Okay.
Anaplastic means it has no resemblance at all to the prostate cells. And these are the aggressive cells that spread easily. They just spread easily. And if you obusa me for Gleason score no near no and you no kwa na dey determine say cancer no ahoden tie ye the PS no so eka
okay
between 0 to 10 na say na Gleason score no 6 you say yare na ahoden of form nemom say Gleason score no ekoye dey say bia 8 na PSA no number 20 and above then yes yare na ano edin sa yare no wan so ano a na say within 5 years almost like half of the people who have that disease would have died from the cancer. And such obusamia, these are the chances of spread.
Okay, so the risk levels also.
Those are the risk levels. So you have intermediate risk level.
Okay.
You have low risk level.
Okay.
And you have high risk level.
Okay.
For the high risk level, you are looking at glycine score 8 to 10.
So that one, they comes with numbers. It doesn't come with your risk factors and that's a contributing factor.
No.
One can our lifestyle.
David.
Okay.
Yeah.
Okay. There are other misconceptions about prostate cancer.
Okay.
And I say some myths, whether myths or misconceptions, that people think say that's really the case. Say will be will be yes sir, and then why specialists say that's drinking alcohol increases the risk of getting prostate cancer. I think so that one you mentioned it already.
I did. Too much alcohol.
Okay. Is there anything one can do to prevent getting prostate cancer as a man? Can obi beka so tuni ho esi ono ye bibi se de be ya or no as be man no onya prostate cancer? Because from your earlier talk no can say every
1 in 6
men get prostate cancer. So,
or even for the blacks 1 in 4.
Oh wow.
80 we are looking at once me can say risk factors no aging untimi nya ho hwe.
Okay.
O papa na wo fa bia na wo nua pani bia nya prostate cancer then na bit my fa untimi nya hwe mfa the first so bibini to say me tie untimi nya hwe mfa so these are the absolute risk factors for prostate cancer. Nya ka say nsanom smoking near that no ho de but enye so strong but kakra wo betimi aye no ene ne nya me kan say ene wo benum sankra na menum bebre ya atiso.
Okay.
Smoking, if you can quit, is better.
Yeah.
Don't live a sedentary lifestyle. Lift. No. Those kind of lifestyle doesn't help if you want to prevent prostate cancer. And for that matter, many other diseases. You need to know exercise is good. Drink a lot of water, eat a lot of vegetables, eat a lot of fruits. These are reduce your red meat intake and now eat a lot of fish. These are
so you can't red meat the example.
Oh, send them to I mean Ganam.
Okay. Okay, does red wine help prevent prostate cancer? Because my man talk about say
no, there's not.
Mono red wine that's ammonia cancer.
And there are no say boakomane kakra.
Sir, yeah, prostate cancer. So it's just a myth.
Maintain that. Okay.
Does masturbating increase the chance of getting prostate cancer?
No, there's nothing like that.
Dog, are you sure?
No, even if.
Okay, Mami Busawe, does prostate cancer alter sexual life?
Say, in fact, it does. A bar, in tema, it did you call nerves no. Prostate nerves supply penis no my erection no. A prostate na say, bakoda. It cancer need the coma, ekuno straight.
Okay.
An operation any radiation therapy and also your effect our nerves and so. It no matter how you have it does have an impact on your sexual life. Okay,
that's have an impact. I want me TV program no your Star Health Talk me din e de AMPOFO je. Ye benum so kakra ba ye ba e be open 4 lines no. Baby a will be abetimi afre na question be about come na yedi na wo bu sampacho se wo fra no low TV no cry nya sa no mute ne cry de making be a hobeti no busa question me ma na ye twen mo course pe o se mutimi busa na yes September is prostate cancer awareness month ye yesi honom na ye ma more education ti de won tia si bia de opeso hunu bia no obusa Dr. Penipa wa hanom se ya obeboa no wa kire ya se ba sisi ya ye ba ya beto aso.
Tiefwe, Wontumi multimedia say be wo kaneno ye cheska na waidie 21st September. Yes, bedidi na hwe wa pomuden free house screening and kenke party. Aye for free. Beshia Tumi multimedia jumefo nyina. Kayo edanu ye 21st September yawada.
Ye be screening be to say ear and throat, hepatitis B, eye screening and the general body screening.
Yen main sponsor any Roca Herbal Clinic. Wonum na kofa Pacum capsules and Metfagin abedwaso. Wachi akwani wabuabu sika fienu mwa. Woni oka hu bi ni OPK Dynamic Enterprise. Wakofa cables ten tia eye papa and phone accessories nyina bi abedwaso.
Herbal Center ma pabiri e won kaseni no mpehwem. Wa mo boa hwe wa pomodi kama dia ma. Kumasi atonso gugu hospital nachi e na abehu omo. Family drilling for ka hubio. Wasi brai na won two super pam fama. Enso ade abefu fidie na etuo. Biogas ne so de. Wo betu ne kama. Wo flash ya na hye abran ka bie ne akiri.
Sawo adwatode bia anso na pese obebua bia obefre 0243 166 342 ana 0559 862662. Yabaje so ne de waka ho.
Ye sha kwa ne waskwa Amas Senior High School na ni mu pe.
Ya the health experts every Comfanoche Teaching Hospital, Mensha Polyclinic, KNUST Hospital, and the hospitals are who bebre and a bedroom.
Wontumi free house screening and kenke party. Bedidi na show up pomuden.
TV. So now there is a kinky party, or say kinky party on Wontumi TV. Wontumi free health screening and kinky party. Bedidi Nesha Wapomoden on the 21st of September this month, yeah, 21st. And on Mode Bremo say ubedi kinka na ya say screening na screening no. You say eye screening, ear and throat screening, and a general health screening to say blood pressure, blood glucose, and then blood grouping, hepatitis, and diabetes. I think say diabetes and only glucose, blood glucose screening. So anyway, and you know, Wontumi TV on the 21st of September. You say, bra ne bedidi, ubedidi we are near access screening free. Yeah, and the program now made the more information ebe to ja na we. Okay, dog. Yes. It seems we can kind of a phone calls no. Now I think cell phone license now activated into no. Omo be free na yeah, it make me a question about masturbating. When they were trying to show some person obe going to say it doesn't have anything to do with prostate cancer. It doesn't. Okay. Okay, so the phone lines are now activated. To be me free na wasembu sebia no odi abana ye no edia mouth. Okay, so dog. Now, person sambo subio about the risk factors. Say niema sebema we see the 40s mono. Obetimi aye now what they are preventing. So want to prevent born whole by now with me. Okay, sing your first caller. So hello. Hello.
Hello.
Yeah. Pacho did this na kase free here.
Pacho me de Kingsley me kase free Kumasi.
Okay, Mr. Kingsley, Pacho asembu sana say.
Me bacho am say dog a cheche nse mu de do ya mo say prostate na genetic.
Yeah.
But me question person buza say na o kan say me dey say obi no mo nsa jot me like other things they do. Na me buza say na how those things now say who involved the percentages are also not frustrating higher enough.
Okay. Yeah. Okay, you said that's a parcel free. But dog, does frequent sex also have anything to do with prostate cancer?
So same way out. It shifts the whole discussion away. So I try to stay away from it. But
yeah.
New
yeah, calling today. Hello. Yeah, Patrol is an actor free.
Hello, but I'm just free and the man.
Okay, Patrol Simbusan say.
You must send this and say. process no. Then when this process no eba.
Okay. Okay. Yeah, that's it. Dog be you was no.
Okay.
Hello.
Hello.
Yeah, I'm patrolling this and I can say free here.
Patrol, yes, if you are going to
Okay, patrol simple son say.
And patrol, I am teaching so me Bermano and I am the same doctor say,
Okay. Okay. Dog got your question at one to be no the amount. Hello. Hello.
Hello.
Yeah, I'm patrolling this and I can say free here.
I'm from just because I'm from Meduma.
Okay, patrol simple son say.
I think this is not doctor can't be sure. Maybe one of the Abeshe working.
Okay.
And that's all muscle.
Okay.
And so no, I said, I don't know why my ankasa.
Oh, okay.
You make a thing who's sad.
Sad then.
Because we can't credit Abeshe, but I said, Pobisa.
Ah, okay.
It's up for no. Because you say here and also come here.
Okay. Okay. Dog bet was so don't patrol. Yeah, that be yeah, no what was. Hello.
Hello.
Yeah, patrol did say now can say free.
I'm from Mr. Kofi, Mr. Kofi colleague no.
Okay.
But me busha Dr. Sendi.
Okay. Until what TV so I chance no what yen kasa.
My brother, one ya prostate TV on.
Okay.
Or prostate TV ya. Omo dey ade akwhye ne be man.
Okay.
Omo dey ade akwhye ne be man. Because on be 3 weeks ago no. Sitting on command a draw be share no say ne be man mu ya ne ya. Friday and I don't know. I only will be an idea. I can't upon a Wontumi and you sent it in the call. St. Patrick Hospital now. Almost watching.
Okay.
And they say, no, again, I say, let me. I won't. One of the one year, the
okay. Okay.
So can you pay and then say, Kilometer at the share?
Okay. That's a parcel busa question. Dog be you are simple sana monti ko so aneshe.
Hello.
Hello. Patroni this na say free. Hello.
Good afternoon.
Good afternoon.
Yeah, that's a good program now where you
Hello, Patrol wait me hello TV ne kakra mai. Hello.
Hello.
Yeah, Patroni this na say free.
We didn't even know because free tema.
Okay. Mr. Iman Patrol simbusa ne say.
Me de me news am me early 20s but me so be free and I do. Yeah, me that so frequently. But me who say I'm going that direction at it.
Okay.
It's something different. Yeah.
Okay. Okay. Yeah. Now got your question to be here no the amount. Hello. Hello.
Hello.
Yeah.
Good evening.
Good evening. Patrol did this and I say free.
But I tema.
Okay, Patrol simbusa ne say.
Na some person say but say would you so express dia would you so and cost street use on express it. Moreover my second question is say who like okay, you answer the first question for now.
Oh. Busani hina na enya no ba.
Well, the difference maybe well but you and maybe I say would you so maybe I'm just what to make me should be anyway but I'm a do in the day would to make you so I'm also this one and so we are
Okay. Okay, that's a panel simbusa. Hello. 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 Yeah, hello.
Hello.
Yeah, Pacho need is an free.
Me Pacho, yes, me. Let's see. Accra.
Okay, Pacho Sembusan say.
Much of this on there. If they're not in I'm a process. Much of this on the process.
Prostate, no. Okay. Okay.
They're not the.
Or the bar. Okay. That's it. Okay. Dog, where you are Sembusan, I think same for 1 or 2 courses in fancy. Hello.
Hello.
Yeah, Pacho need is an free.
Good afternoon. Your friend is here. You also working out again.
Okay, Pacho Sembusan say.
My thing is first thing I think you are more watching here. My testing, you know, from your friends at PSC. My PSC test.
Yeah, prostate specific.
First one. First one, the results near 3.79.
Okay.
And on the 13th of April 2023, which is this year.
Okay.
13th of April. And I'm a second one because now I'm a second opinion.
Okay.
The second one, it was different lab. And also results near 0.98.
Okay.
0.98. And also now 25th May 2023. And meaning, so with these results, Dr. Bettini, I can be after much because no more can say I was sending another test. No PSC, only be different for you. I was sending for the actual. If there's something wrong, and I think yeah, normal.
Okay.
But the doctor didn't actually too much.
Okay. Pacho age say?
Me are 53 years.
Okay. Cause one here dog be your question and normal. Why? Dog be yeah, they are phone basis so that you bet me your questions and I do also. Okay, nti do be as so for nyame adman next week e beto aso into question bia will be abet me dey ahye fridge nyame adman next week ye to aso na wo busa ye da mase dog
yo me da se bebre me say the odi kan ni busa say me say prostate cancer no enye genetics na so obi ho na ensane smoking ni ni aka no onye bi a obetime anya prostate cancer na me ka say genetics ni play part me can say at least about 10% of time no o papa nya bia ana itimira no abusiam ana feel so no risk factors na me can no me can say the main ones no first 3 which is aging o ntimi nya bibia mfa wo mfia wo benya ho once I obenya 40 years ekono o risk e was ro chen akwala ya wo na say a branch on 20 years and the first a black man no enso kire say risk e was ro chen broni and I was ro crab be chen Japanese ni China for ana ne tosu mienu say family history some fans say okay family history no where you from but ne aka say drink too much alcohol, too much smoking, sedentary lifestyle and no impact no form in terms of causing prostate cancer but if you can avoid them and do something about it, it will overall no wow you told me you say what causes prostate cancer. I know the say di kan Canada yen sheda nim ade ko potia ade prostate cancer eba na mom ne nim no say associated with risk factors and say wo nyini ana say obusuani bi anya bida ana say o black man ana o tie nom san bebre ana o tie smoke ana o nye exercise o tie pestra de nam nya dade ana ya kan say ne obetimi aye ni say titi sa ne ma we so na ne tosu mienu no ya eat more fruits and eat more vegetables eboa obisi wanya pains ewo ne bema no na no so ye den obitimi nya infection in the prostate, a friend of prostatitis. It can cause so much pain and discomfort, especially referred to the tip of the penis. It can be quite difficult to treat. Uncle doctor na yenhwehwe mwenhwe. Okay. Obi nso busa say ade BS na chi doctor ka say bia be na BS bi obi mu maso ana say eno nso ye cancer na. In fact we dey mama me chechire mu ye na wa nkokotumi baby wrongly. Prostate cancer no because it may spread it me eko baby me hu papa bi na nani baako epia eyi atofo mo ani say na prostate cancer na akohye nani nachi ay push nani ne ba
Wow.
Ai. Me hu ba kon so ana ne mama so ade bi bo so say torchlight. Ana me doctor pani say me nko twam ne mpompo na abon me twam na fe moja nko a. Me de me sa fe mu na chese nompe na bone na are I very brittle, broken. Yeah, prostate cancer. But you see, Sanima American, if you be to say lipoma, Sade beat me a tall home baby, not a yakasi. A man found no question because when you're a diabetes until when you're prostate cancer. Doctor and a bit me I can't say the way. Obviously, in I shall rubber. I'm more try so more ye. I feel when to me, so then you be a phone. You see, and Pempi, no, yes, I say, me, Ubusam, say, near my benny, beat me their confusing prostate cancer. It be a just BPH, say, benign prostatic hyperplasia, prostate like a sick cake. And noon, a bema doctor, I shall rubber, or best say, yeah, say, or do two no so a bay ya. I knew is Anna, a ya none here and say operation. So, prostate like a sick cake, cancer be a new, and a cause of retention of urine. You try first time. Ebe ma onro science is here na surgery I friend of prostate and a simple prostatectomy I see is out in you man so tema also 20 years na otadwun so bebre na and also there enye 20s ni de on say maka say yenyan hu obi a 20 years awanya prostate cancer da na mom nyoma bebre ana etimi ma nipa etimi dwun so bebre bi to say sichare bi to say wanya infection e wo odwun so twam ana say o prostate num ana obema num prostatitis ni nyina etimi adwun so bebre bi say hwehwe man san na yehu obi say ne dwun so no mastrate etimi petipeti and also there be
na sa ade no asene say because on say especially herbal way for no omoye omoka say Johnson no etwa ehuro ana ngufa akwa na pemu paitu like what is the physiology behind all this?
Thank you yeah me shede busa madam for be American very good urologist as a problem we enya already so pa na ono na adwen e fa ho ne so see o empempi we mema tena emu be 3 amodwen so na ma straight e petipeti obekwa akohwe mu odi afidi be hwe mu be mem na hwe nim into at least 30% of time a normal finding people are just preying on your ignorance and taking your money but nye nim apa etimede o emuchemi no ana bebre ni ye sekutwa aba o tokro na odwunso fam no efe ni urethra no no yes bi obi anya gonorrhea na babaso yare no some time ago na a healing na ayekutwa nti odwunso abun se machemienu ana chebe enti urethra stricture pa ana a time adwunso muchemienu and also abibiduro even a brofuduro crant means ya na ye operation ana me hu obi so wanya prostatitis na dwunso no so na muchemienu and inflammation in the prostate ana obi so na se odwunso anadwo bebre during the day there on time and so empempi otadwen unya 40 years e kono na start dwunso bebre anadwo ya hwe o suban bi okoda menum nsi obebre ana yare bi so te say sichirare medican aka prostate ni eye kese a eno so e decide ne ba ana infection ba prostate ma eno so de ba but empempi no say BPH ye just a benign enlargement of the prostate ne futu a demand say bobe 6 kona menum nsi obebre ebo ama ultimate yi obi abusa say na prostate cancer no kra then na de ba and they say I can't that and prostate diseases in general and then na de ba underlying factor ni aging unyine empempi no prostate ni ekese ekese a keke na kokran bi anima e friend BPH ana say enye ekese mpo na infection bem eno sitim adwon so bebre e ma wa ya sitim ye oya du okra na ham etimi tutu no pa na ya situtu no odwon so a emu ye ne ya ana mpokro to keke kra obi ka se ne tip no dwon so ne be man no etimi ani apa prostatitis
okay
inflammation in the prostate etimi decide ne ba papa ba ko so nya mfie aduan 53 aduanum miensa odi ka ko ye PSA ba ko na ye 3.97 and sa ko ye second one na ye 0.98 na and but na different lab the mechanic say unfortunately for us some of our labs are not standardized labs.
No cry, my last question be busa.
Any standardized lab. We be kwa koye PSA
anyway.
Me cap me ko bo obi nso din dia na say me.
There be but ebia government hospitals. Oko hospital, me fan say bia me sia confirm not.
Me ko say obi adwuma, say onko.
Me busa say
because they are very good private labs. Very good private labs. I'm reporting they're very good. Abayin so Confanoche very good.
Okay.
But there are some labs I mean more than unfortunately.
Yeah.
Or the lab nearby I will show you another process. I call her and PS you know and it would have been better. Say okoye no baby or your first one no was raw. After about 3 months, no say ye will be and near better than say switch there now nim say call a reference lab a very standard lab me say anko boja baby say anko ye koye no baby standard
boja is chim house unchim say lab na he fan ye no but wait me walk into any government hospital so be
yes
okay doc
yes
your phone abo
yo
my take home
yo nti nyameka fa prostate awareness creation ye nyina and say yare bebre and confuse nipa from prostate cancer.
Okay.
O prostate ni betimi ayekese ebe how bi okra ebe me ahye rubber anase anadwo be how bebre bitimi dwonso be 10 onakra enso no the first point of call so be call e bia heba. Unfortunately, herbal for no ensem on sem say otutu for prostate cancer and also otutu for BPH. A friend will be benign prostatic hyperplasia. Ayekese keke. Mpempi yempukra or doctor muno. You use plant-based medicines. A friend of phytotherapy. It may treat benign enlargement of the prostate. Enti anka from so bia ni ho say before herbal for no so treat but mpempi no ba doctor if you hu say yare no cancer bia nim kokran bia nim ansa na do atu no so it will PSA why ye monitor ya densa shorto ye hu say oh we dey betimi aye say cancer ni ahwehwem ehwehwem na enye cancer na ono mo bibidura no problem ana mpokra na bibiduro no bi ho a na dwinso no bebre na akam odwinso a bebre na eden ekam enti ama pressure beto kidney ne so dada enti usa no ma bibiduro na entimi mma no na ese kidney no enti a problem pa e deal with no enti cancer no ye ntiti o before infant prostate cancer ye ntiti no ye mfa heba ntiti enyi say ye kese keke na ye dia heba for no ebetimi aboa.
Okay.
Nemo eya omo hwehwem. Omo hunu say kakokram ewo ma. Omo famra hospital na ye hwe ni ntem. Dan so omo be koso ama omo ndro na nipa ne beba na obubu agu complete. Bi beba na chese yare no agensem complete. Enti afuto bi ho a ne meka no.
Okay, dog get that sepane inchishima or the Miami had man next week dog hanum say better as your treatment no and then also home complications any strona emma memma no bebe no ko dia yarecha or mode call other alternative medicine no na afia koya asemfofo Miami had man next week be the home come doctor any train come no Dr. Kwaku Ade Ahen Apia or a senior lecturer School of Medicine Dentistry KUST no side head of urology unit Department of Surgery Confanoche Teaching Hospital and your topic you and your prostate why you should care and I hope say you educate you na me adman next week some see a better so near my care no so no you emphasize on it pa ya show ye na etimi aboa but I think say the fundamental when you say we a bema 340 corner shall screening screening bohuka SBS mama yehoka be maso bohuka ne screening ntimi mboa because prostate no I think there is silence can I say the second killer disease yes in men yeah ntine ho asem no
second cause of cancer deaths
second cause of cancer death in men
second cause of cancer death in men okay. Apart from liver cancer in Ghana
okay ntino utia na watu hwana mo na etimi abo ye kweti an wes ndebia meka say do awareness question all the time I say enye but do awareness na ya na more doors are open ntino ko ya ebetimi ahwe wa ma wako ne screen na wako but I don't think say more programs there more outline more ya na say there is no program going on as a department
as a department afi you be hospital akoy operation free surgery
but for screening maybe a money free screening because for not say emba me and I will be a small token be so that some baby screen
Wontumi mo organize
okay so I not know Wontumi for organize a health screening or say kenke party with health screening or say didi na show up on the 21st of September Wontumi omo de nema to akwa mo ye pa 21st of Brahanum say Wontumi station here ya oba ubedi kenka no wa say screen ye screening bebrebe say oba ye be hwe wani ama ye be hwe wasum ye be hwe minimu ye be say your lab screening bebrebe ye be cheche wonsa ye be hwe so diabetes and ase woni bia hepatitis and also one silent ye ye be hwe ni nyina ama na doctor de ne de eche ye be hwe say mbetimi aya aka ho
mfa ka ho mai
mfa ka ho no me be say obetimi so afre for inquiries and after for sponsorship 0243 166 0243166342 and I say 05598626662 now wo sponsor na sell person wonye bibia on find about said e be ko bibia na wo mo bi so ade beboa ofra e betimi aboa o person be ba Wontumi station hanom say wo ba penifo be chechiro mo de ko bia enti no on the 21st of September bra Wontumi forecourt here na ye no be dikenka ya say screening ye say doctor for bebe ba e be free confirm no che e be free kan UST e be ba o ba e be sama health talk no e na be boa wade a wonim no e na wo ye victim ho ntu ba na chewa no so betimi aboa na wafa ho di e wo yare nsem ho okay so dem bi kan no ye the program no esi hanom say na say bebe ko me production crew and Kwame wo MCR and then me home Mr. Fred, Mr. Bosheba, I don't know some more around that. Then my production manager Mr. Christian, so me that was CBB and I said so come AGYEI design so no and then my graphics in mama oh friend now or crab baby I will be need the OPB about graphics piano or by yama frequency it was 0546683647 0546683647 me scrap and so free scrap hub GH for one more it was 0533911811 0533911811 and I think say previous weeks so na ladies fashion have fun and share material so show much akwan e wo Facebook e wo Instagram neton tare wo mo honom it was so jemre show your star health talk nya me adman next week sem kaka in the beto so ye wa ha say ye bo apomuden ho dero na say dem ya na meta can say here sponsors mumba wade o me sponsor need to nye program na kama mama this year October ye be try na call secondary schools no about breast cancer you better talk rather we won't do a walk we better talking to no secondary school be all interested that obetimi ama ya so ateni aba ya be ma help talk o honom na sembia so a person will busai and the school for no busai about breast no yetimi educate you mo I Wontumi TV program no your star health talk me din e de AMPOFO je nyame admonistic here be sure